right, so introduction. This is our nurse, Heather. This is our patient, Sandy, her husband, Alec, and
The cheater.
me. I'm the nutritionist.
And the
I'm the
nutritionist.
nutritionist.
Come in.
Come in.
Good morning, Miss Sandy. My name's Heather.
In front of her.
I'm going to be your nurse today. Just tell me your name and date of birth.
Sandy Harris, 8/22/68.
All right, perfect. So it looks like we got your ultrasound results back. It did show you have polycystic ovarian syndrome. Have you been diagnosed with that before?
I have not. Do you
What
know
is that?
What is
I
that?
don't know what that is.
Okay, so it's where you develop these cysts on your ovaries, and sometimes they can rupture, causing a lot of pain, and that's why you were brought in. They're just fluid filled, but since one did rupture, the doctor is going to start you on antibiotics.
Oh no.
Goodness, you thought it was your period, didn't you?
All right, so we're going to get you discharged and ready to go. Do you have any questions for me?
What is it? How is it transmitted? Is it something he's done?
No, ma'am, it's not sexually transmitted. Just sometimes your body reacts to some sugar levels that you have and cause it.
The way you cook.
Baby,
I told you it was going to kill
I
us.
didn't do anything. I did not cheat.
But dietary and lifestyle changes can help. Also, I'll have a nutritionist come in and explain some diet changes.
Okay,
that
because I
you
have a
can
lot
do.
of questions.
Okay, and then we'll also place a referral to gynecology. Do you already see a gynecologist?
I do.
You do? Okay, do you want me to place a new referral to them for you?
Please.
And what is their name?
Dr. Smith.
All right, I will get that sent in for Dr. Smith. There is medications like birth control that you can take to help lessen your symptoms, okay?
Okay, thank you.
All right,
The
give me
nutritionist is going to come right in.
Yep, give me just a minute to get her, okay?
And what was
Thank
your
you.
the nutritionist's name?
Her name is Callie.
Okay, what was your name?
Heather.
Okay.
Thank you, Heather.
You're welcome.
I know this has something to do with you.
It's not me.
An eternity later.
Alex,
Hello.
I know it has something to do with
It's
you.
not me.
Hi. How are you doing?
You're good. How are
We're
you?
not
I'm
so good.
Oh,
We
not
tell
so good.
stories all the time.
Oh gosh. All right. Well, I'm the nutritionist here, and I'm here to give you some pointers about your recent diagnosis.
Okay.
And can you verify your name and date of birth?
Sandy Harris, 8/22/68.
How old are you? You look young. Don't you look young?
I'm 26.
Sugar,
My
don't
goodness.
flirt.
Yeah.
You're always flirting with somebody.
Only you, baby.
All right. So, what kind of diet are you currently? What would you say, your everyday diet looks like?
Well, I am a diabetic.
Okay.
I know that I'm not supposed to eat a lot of sugar and
Right.
processed food, but
We
the
do
way
love
he
our fried
cooks,
foods.
yes, we do love our fried foods.
My fried chicken.
It is the best.
Okay, well, so with this diagnosis, there's actually some diet changes that you could make that would help
God.
with your diagnosis, with the situation. So some of those include whole grains, so
Okay.
like brown rice,
Okay.
oatmeal,
Okay.
lean proteins. Do you eat any fish, beans?
Yeah, I can do
anything?
that.
Yeah.
The
Okay.
sugar will be the hard part. And
Sugar-
I think we can.
And you can have
manage.
sugar in moderation, but you want to really focus on incorporating some of this in your diet.
Okay.
But it can actually reduce the hormonal changes and the resistance of insulin, so that would actually
Okay.
help with your diabetes. And it can also reduce inflammation.
Maybe I'll lose some weight, get back in that bikini.
Okay.
Yes, and we definitely want you to exercise, at least try to exercise 30 minutes a day if you can, some sort of physical activity.
Okay.
So does that mean like no fat in our diet at all? Because I like my fatty foods. This
Yeah,
big back.
and I like your cooking.
This big back, I did this my way,
Right.
naturally.
Right, you can still have some, but you really want to try to keep it in moderation. Especially right now, you want to start practicing incorporating these things in your diet, but you don't have to completely stop, just in moderation.
Okay.
Okay? So yeah, so I have some handouts to help you remember
Okay.
kind of what we recommend as far as diet and
Perfect.
exercise.
Our memory's
you.
not as good as it used to be.
Yeah.
Okay,
exactly
that's why we have
right.
handouts. Do you have any other questions?
No, I think that'll do it. We'll call if we have any further questions, won't we, honey?
Mhm.
All right, sounds
And you
good.
said that we should eat more like dark leafy greens,
Mhm.
like legumes.
Yeah, and like spinach and kale. So if you like salad, you can always incorporate different kinds of salads.
I
Kind
love a
of
grilled
mix
chicken
it up.
salad.
Yeah.
Grilled chicken salad would be perfect. Good protein and good green leafy vegetables.
Okay.
Good.
Yeah.
That sounds good. This is a lot of good information. We thank you so much.
You are welcome. All right, well, I'm gonna head out. I think, did the nurse already, I guess, do this?
She was in here.
Okay, perfect. All
So
right.
she'll be back.
All right, well, I'll send her back in, and I hope you have a good day.
Thanks, Callie.
You ready to get out of here?
Hi, I am ready to get out of here.
All
He's
right.
driving me insane.
All right, Miss
For both of
Sandy.
us.
Yeah.
Just tell me your name and date of birth real quick.
It's
Ken.
Sandy Harris, 82268.
All right, and I'm Heather. I met you earlier.
My name's Alexander. Thanks.
Wow.
I'm sorry, honey, I should have introduced you.
I just want to feel included. I'm
I know
sorry.
you do.
It's okay. So we went ahead and placed that referral, so they should be in
Okay.
contact with you.
All
Give
right.
it about 2 weeks before you hear from them.
Okay.
If you have any more pain, any abnormal vaginal bleeding,
Okay.
come back into the ED or follow up with your primary care
Okay,
physician.
I certainly will.
We went ahead and sent that antibiotic in. You wanted to go to Walgreens, correct?
I do.
Okay, perfect.
That's a terrible place.
So we went ahead and sent that in. You can take ibuprofen if you have any pain. Helps
Okay.
with that inflammation as well. Do you have any other questions?
I don't think I do, honey. Do you?
Do we need to do a follow-up on this visit, or do we just follow up with our primary?
You can follow up with your primary, but the gynecologist
yeah,
should
that
be
would be-
calling
yeah.
you.
Okay.
Absolutely.
Okay, and they'll get you started on something and give you a little bit more information of how to treat it when you go to their appointment.
Okay.
Okay?
So are we
Anything
good to
else?
leave?
You are. Here is your discharge papers. And do you need help getting out of the vet?
No,
I can help
he
her.
should help me.
Okay, well, you guys have a good rest of your day.
Thank
If you need
you.
anything,
Nice to
give us
meet
a
you.
holler.
I will.
Thank you.
An eternity later.
Do we have anything to eat in this house? Absolutely. Eggs and chocolate.
Hey, honey, what you doing?
I'm trying to find something to eat.
What are you trying to eat?
Well, I wanted to make me a drink. Is there anything wrong with that? Are you going to continue to fuss about this diet that I'm supposed to be on?
Honey,
I'm sick of hearing it. I know I need to lose weight and watch my sugar. But I just can't do it anymore.
it's okay. We can work together. We gotta watch
Saying
your
Mr.
blood
Healthy.
sugar. We gotta watch our blood sugar. You know what
Yeah.
the nutritionist said. We have to make sure we're eating our leafy greens, our legumes. You love legumes.
You are the one that goes to the grocery store, honey. Do you
Well, you
remember
can come
that?
with me. The
You're
car's
the
got
cook.
2 seats, 4
No,
wheels.
you're the cook. You go to the grocery store. I can't help what you fix me to eat. But right now, I'm gonna have to drink this.
No! No, don't do it!
What if we get like some sugar-free, non-fat
It's
milk?
not as good. I
No, but
can't
at least it'll
it.
help your health. It's
Are
better
you-
than nothing.
Are you not gonna make me any more margaritas any longer?
We don't talk about that. Margaritas are a different subject.
I need one now.
We're not gonna put
That's
sugar in
right,
it
I
though.
know.
So we love sugar margarita.
Yeah, a skinny margarita.
Skinny margarita.
Whoever made up a skinny margarita?
Me, because I want to be skinny.
I'm sure you do. Good for you, but it didn't have to rub off on me. So
But
we'll just
that's
not
what
say
the-
anything to anybody.
Your body will tell you whenever you start bleeding out of your vagina.
I know.
And your
I know.
stomach
I
starts
know you're
hurting so
right.
bad.
I know you're right, honey. I'm sorry. I'm sorry.
I know.
I'll try to do better. Okay.
It's okay. It's not your fault. You're going through a lot right now. You're going through a lot of
Listen,
changes.
speaking of that, have you heard from my doctor?
No, they haven't called
They
yet.
were supposed to call to set up a referral.
Yeah, I haven't heard from
No,
them.
I haven't even. Oh, maybe that's him now.
Oh, I hear it vibrating.
Right.
Hello?
Hi, is this Mr. Harris?
Yeah, this is Mr. Harris.
Hi, this is Callie with Dr. Smith's office. How are you doing?
We're good. How are you?
Yeah, we just wanted to check up on you. We got the referral, so we'd like to make an appointment.
Yeah, I would love to do that. I'm on the phone too. Hi, how are you?
Hi, Miss Harris. How are you?
Well, I'm doing okay. I'll go ahead and make an appointment. I'm not doing so well with my diet. It's just been really hard. And
Okay, you're struggling with the diet
I'm
a little
struggling
bit.
very much so.
Okay, how about the exercising? How's that going?
Well, we have been walking more.
We have been doing more walks.
Yes, I have been doing more exercise, but the diet has really just thrown me for a loop.
Okay, and it does take time. Adjusting diet, it can be very, life-changing. So whenever you come in for your appointment, we can discuss some options. Maybe try to incorporate different kinds of food in your diet, but maybe not a full 360 turn right now. So we can figure out and come up with a plan. We'll talk about all
I
that.
mentioned her stuff like low sugar type of sweeteners.
Right.
Or like she likes her margaritas just as much as me, so maybe some like margaritas that don't have as much sugar in it.
Right, exactly. Just little things like that. It can be very overwhelming, but like I said, when you come in, we can definitely get a plan going, and we'll discuss all of this.
Okay, awesome.
I'll try. I'll try again, honey. I'm sorry. I've not been
okay.
reluctant to do this. You know how much I just love to eat.
It's okay.
How-
Obvious,
This
but,
is
you
a
know.
big change.
How does Tuesday at 3 sound?
I think we're free on our schedule.
Yeah, that sounds good.
Agree.
Yeah, we can make it.
Yeah. that
Okay,
works.
perfect. So, you'll meet with me, and then you'll meet with the your provider, and then we'll also get another nutritionalist to maybe send some more information, and we'll just go over a plan and diet for you.
Okay, well, I
If
have been
that's
taking
okay.
my medicine. I've been taking my medicine.
Okay.
I'm trying to exercise regularly. So I think just help with the diet is probably, if we could just get going in that right direction, that would
Yep.
help.
And you know, the big thing is that you're really trying to change your diet, so that's where it starts. As long as you are putting an effort forth, we're gonna figure it out, and we will get you on a plan.
Awesome. Thank y'all so much for your
Thank
help.
you.
You're welcome.
I appreciate it.
Have a
See you
good day.
soon.
We'll see you
See you then.
Tuesday.
All right,
Bye.
bye.